Hey guys, thanks for joining me again for another episode on my YouTube channel, Long Live the Brains. Today is a very special day for me because it's the date of the home opener for my favorite baseball team, the St. Louis Cardinals. Die-hard Cardinals fan, and it's practically a Tipton family prerequisite that you love the Cardinals. So when my wife and I got married, that was one of the deals that she had to start supporting the Cardinals. So as important as the Cardinals are to me, I want to talk to you about a more important issue, and that's accurately diagnosing neurodegenerative diseases. Now, whenever you go to the doctor, of course you want to get an accurate diagnosis. If you go with a cough or the sniffles or a sore throat, you can expect that by the end of the day, hopefully, you'll be told that you've either got, the common cold or strep throat or maybe even the flu. But as you can probably tell from the previous videos, neurodegenerative diseases like Alzheimer's disease or Parkinson's disease are complex diseases. They can present in a variety of ways, and there's oftentimes overlap in the types of symptoms that come with these diseases. Now, unfortunately, because of this, misdiagnosis rates are high. So it's important for physicians to do an appropriate screening and get you in front of the physician that has the best chance of making that diagnosis. Neurologists are trained in diagnosing these neurodegenerative diseases. Now, there are a few reasons why getting an accurate diagnosis is important. Some people may say, well, you don't have cures for these diseases, so why does it really matter? It matters tremendously. Number one, if you don't know what disease you have, you don't know what to expect. Furthermore, if you get told that you have a different disease than what you actually have, your expectations are probably going to be wrong. If someone told you that you had Alzheimer's disease, but in fact you had Parkinson's disease, it wouldn't make much sense when you start to develop a tremor. Another reason that receiving an accurate diagnosis is important is for support. Here in the Jacksonville area, there are great support groups for Alzheimer's disease, Parkinson's disease, and many others. But if you don't actually know the disease that you have, it's hard to get plugged in with a support group. But when you do, it's very helpful to know other people that are dealing with or have dealt with the similar issues that you're dealing with to move forward together. Now, the last thing that I want to mention is that if you don't have an accurate diagnosis, if you don't have a diagnosis, you can't be enrolled in a clinical trial. Unfortunately, none of our neurodegenerative diseases have cures right now, but the way that we get to cures and better treatments is through rigorous research and clinical trials. So you've got to have a diagnosis, whether it's Parkinson's disease, multiple system atrophy, dementia with Lewy bodies, and then once you have that diagnosis, you've actually got a chance to enroll in some of these trials, whether it's a trial for improved diagnostic modalities or a trial for treatments. But without that diagnosis, you can't be in a trial. So I hope that I've kind of convinced you how important it is to get an accurate diagnosis. If you're concerned that you or someone you know may be developing one of these diseases, please seek out an evaluation by your primary care physician. And after he or she does an appropriate screening, if there's still a question, I hope that you'll get evaluated by a neurologist so that, one, you can either be told that you don't have one of these diseases, or two, you can get to that accurate diagnosis as quickly as possible.